Welcome to another edition of Cityscape here on 97.7 FM, The City. Um, we are doing a very interesting interview today, and I just want to first of all welcome everyone that is catching us locally here over the airwaves, also those that are catching us online, as well as those watching us on Facebook Live and YouTube Live. Welcome to another edition. As always, we've got great interviews here. Today is no exception. We've got a gentleman. He's a lieutenant colonel in the military, Lieutenant Colonel James McGinn. And so let me go ahead and bring him on board so you can meet him, and we'll get to talking in just a bit.
Mm-hmm.
All right, I think we've got him. Colonel, welcome.
Thank you.
Now,
it's very nice to be here.
Thank you for making the time to talk to our audience. Now, Colonel McGinn is over in Austin, near the Austin, Texas area, and so we thank you for making the time to join us. He has almost 40 years. This gentleman's got almost 40 years of service in the United States Armed Forces, and so we want to thank you for your service.
Thank you very much. Appreciate it.
And this gentleman's still active, and he is also an RN, a registered nurse, and so he's been overseas. Some of his military duties have taken him to places like Germany, Japan, Iraq, and so he's got a very long, extensive military record. And a very interesting topic. We're going to be discussing a topic titled "Experiences with living with serious bronchitis disease." Right? Is that the topic for today?
That's correct. Bronchial disease, all sorts of different types of bronchial illness.
Now, I met this gentleman at one of our trainings, and he was sharing with me very interesting information, and so that's why we decided to bring him on board, because I believe the information he's got to share needs to get out there, and that's exactly his goal when we were talking, and so we hit it off, and we said, okay, we've got to continue this in a podcast so that other folks can benefit from it. So, Colonel, without further ado, the floor is yours. I want to hand over the mic and tell us about living with serious bronchial disease.
Okay, I was born with pneumonia and bronchitis nonstop. Basically, 5, 6, 8 times a year. Lots of antibiotics. By the time I was in the 4th grade, I went to the library and I got every book they had on lung illness, and I read them all. And then I went back and got every book on anatomy, because I realized early on that you can try to manage your lungs, but if you don't manage the rest of your whole body, your lungs may not get to the optimal benefit. So I went and researched all the anatomy health books from the 4th grade in a desperate effort to try to manage this problem. Bronchitis cost me a lot. I'm shorter than all the males in my family. My daddy was 6'2", and all of his brothers 6'2" and higher, and all my cousins. I'm 5'9". I lost 20% of my lungs permanently. Lung capacity is measured by functional expiratory volume, FEV. And my FEV is 80% of what's expected for a male of my sex and my age and my size. And it has been since the age of 25. But let's see, during the 7th grade, just some of these experiences that I've had, I've thrown up from my lungs multiple times. Very few people have ever done that. In the 7th grade, I was put on a cystic fibrosis floor in a hospital for a week. And the CF floor, that's how long it took to diagnose whether you had CF back in those days. It's not like that today. let's see, there were about 8 boys on that floor. They were all males. Two of them actually had CF, and those two. I'm 12 years old in the 7th grade, mind you. 2 of those people died while I was right there on the floor of CF. I was there to figure out if I had it or not, and there were me and 5 others. We're all trying to figure out if we had it. Well, the physicians told us that, remember, all of us ate together. We did all our activities together. We played together all day. And so the physicians always talked to us all together. And so they announced that they would tell the 6 of us still surviving whether we had CF or not on Friday. So Friday came around and all 5 of the others had CF and I didn't. Of course, I'd be dead right now if I had CF. But anyway, I told them as I left, I said, well, at least you guys know what you have and can have you have a knowledge that you're going to live to be about 21 years old. I didn't know if I was going to live till the next day or not. I still had no idea what I had. I weighed 130 pounds when I graduated high school. I weigh 180 now. My whole life was consumed with dealing with bronchitis. I wasted incredible amounts of time. I lost about a third of school. I figured it up. About a third of my school time lost forever. And remember, learning happens when you're younger, preferably. The youngest, the better. And so what you lose as a young person is just not regainable. Remember, all of this preventable. I served 4 years in the Army. They're still giving me antibiotics. So then at age 25, I met a guy. I became desperate. I was getting my antibiotics and medical care from the Student Health Center at the University of Kansas in Lawrence, Kansas. And I ran out of money there. And so I went to a community college, Kansas City, Kansas Community College in Kansas City. And they don't have a student health service, of course. And I had pneumonia. And remember, when you go to a doctor when I was going to a doctor at that era and still today, I never went until I had pneumonia, because if I did, all they would do is give me cough syrup, and cough syrup never did anything for me. And so, of course, I had pneumonia. And so I was a military veteran by that time. I'd already served 4 years active duty. And so I thought, well, in a desperate last-ditch plea to get medical care and get antibiotics, I went to a doctor in the VA. I went to the VA for the first time in my life. And I had a lot of information about the VA already. I knew that there were troubles. There's a lot of problems with the VA associated. I personally have nothing but good things to say about the VA. But, I'd heard about that. And so I heard I could go to a large VA. And that is actually good advice, especially one connected with a medical school. And so I went to the Kansas City, Missouri VA Medical Center, and it's connected with both UMKC, the School of Medicine, University of Missouri in Kansas City, and to KU School of Medicine in Kansas City, Kansas. And I found out later, I saw a KU School of Medicine resident. So they have the latest information on this problem. And he indicated that he's treated me totally different on this problem versus what everyone else was doing. He wasn't impressed with me at all. Most of the time you come into a new doctor, you have pneumonia, they're like, oh, alarmed. They're like considering to put you in the hospital and admit you and wondering what they should do. And this is a big deal. But he wasn't impressed with me at all. And he goes, I can get you off these antibiotics if that's what you want. And I said, I've been trying to get off antibiotics for 25 years. Have you got a plan for me? And he said, well, the first thing you have to do is quit smoking. I said, I have yet to light the first cigarette of my life. Is there anything else I'd need to do? And he noticed my weight, and it was 130. I was very thin. And so he starts talking about AIDS. This was 1987. AIDS had just came out about 1980, and I'd served in the Army 4 years, 80 to 84, and they gave me a negative AIDS test. Yeah, I took an AIDS test, and it was negative every other year that I served. And that's what I told him. All of my AIDS tests are negative, and I was born with pneumonia and had it all my life. And he goes, well, I'll tell you what, because of AIDS, we're able to now draw your immune system. We can draw your immune system. I can lay out exactly what is wrong with your immune system for you. And that's what I'm going to do. You go to the lab, get your blood drawn. You go to the pharmacy, get the last antibiotics you're going to get from me. And he was so confident about this. And come back in 2 weeks. And then he even said, you have to come back in 2 weeks because I got to see if you're over the pneumonia. And I said, well, I'll come back in 2 weeks because if there's any hope for me, I want to know what it is, you know? So I'll definitely be back. And so I did come back. And the first thing he said the moment I walked in the door, yep, it's a real simple problem. We're fixing it right now. And I said, wait a second. If this was so simple, why wasn't it fixed 20 years ago? And he said, well, because it's easier to give you an antibiotic and send you on your way. And I said, I was like, well, anyway, okay, so what is the problem? And he explained it to me. He even said, you've been told that your immune system is weak and needs a boost from the antibiotics to get over colds and bronchitis and pneumonia. Yes, that's correct. He goes, well, no, your immune system is just fine. There is actually no problem with your immune system at all. It's very strong. As a matter of fact, it works too well, but only in one component, and that is IgE. Normal IgE is 0. It's normal not to have any and very desirable. Any IgE that you have, it will just make you sicker when you have a respiratory illness. My IgE when I was sick was 800. And it was drawn later when I'm not sick, and it's 300 when I'm not even sick. And normal is like 0 to 100. It's not even desirable to have any. And so and therein lies the problem. And you know, it's very interesting. And so I said, I actually asked him, what is IgE? And he goes, well, it amounts to your histamine level. And I said, are you saying that I need to take antihistamine? And he goes, you're going to be on antihistamines every day the rest of your life. And it turns out he was absolutely right about that. And hold on. Anybody that is on antihistamines will have to drink some fluids occasionally from having a dry mouth. But I tell you, it was, you know, when he told me that, like people right now today, when I tell people that, they don't believe me. They don't think that it just doesn't make sense. It can't be this simple. And I'm here to tell you, you know, I didn't explain the lung illnesses that I actually had other than bronchitis. I had bronchitis. I had bronchiectasis. Bronchiectasis basically means you have bronchitis all the time. It's a very serious disease where there's mucus in your lungs all the time. Then I had pleurisy. Pleurisy is an illness where you have a pleural membrane that lines your lungs. Whenever you cough excessively enough, I mean enormously, in enormous amounts, you will end up developing a blister on that pleural membrane, and it rubs between, when you breathe, it rubs between your lung and your rib cage. Hurts like hell for about 15 times, and then it goes numb, and you basically don't feel it anymore. And I verified that by breaking my rib cage. I broke my rib cage in 5 places, broke 5 ribs, and went to the doctor, got an x-ray. It wasn't back, it wasn't vertebra, it was just ribs. And he asked me, are you having trouble breathing? And I said, no. And he said, you got to be having pain. You got to need a narcotic. And I said, well, not really. I know it, I can feel it. And he goes, there's got to be a reason. And I said, oh, that's because I had pleurisy 30 times, 50 times, countless times. And he's like, oh, okay, yeah, I understood. So, I mean, that's how much pleurisy I had. Uh, then I also had they get diagnosed chronic bronchitis, pneumonia, strep throat, sinusitis. Sinusitis was a major deal. That's a big problem for a lot of people. And all of these things, of course, you're supposed to get antibiotics for. I never get antibiotics for any of them now. All of them are treatable without the use of antibiotics. They honestly are. Pneumonia, maybe, I mean, the doctor did give me 1 dose of antibiotics for pneumonia, but people getting pneumonia today, no, it's all preventable. I'm here to tell you now, you have been told wrong. Kyle Busch just died the other day, 41 years old, NASCAR legend, one of the toughest people to ever exist, and he dies of pneumonia, sepsis caused by pneumonia. Many people we lost from COVID, 1 million people. The U.S. lost 1 million people to COVID. Most of them now the people who had COPD or CHF, then that would be a good reason to lose them. But the people who had no prior illnesses and they died of COVID, there is no excuse for that. And I'll give you an example. My own sister got COVID. She too was one of those who didn't believe me. She didn't think I had a clue what I was talking about. And so, and remember, this is my own sister. I mean, we were raised together. We were born, she's 1 year older than me. She was born a year later than me. I mean, a year before me. She's 1 year older. We lived together our whole lives, and until we became adults. And I told her a long time ago what to do about lung problems, and she ignored me. And so she goes out to Irvine, California, is where she lives. She got COVID. She went to her clinic, and they gave her antibiotics and antivirals. So she thought she was covered. She was good to go. Well, they gave her a 2-week supply. And at the end of the 2 weeks, the medicine ran out, and she still had all the symptoms of COVID. And so she called the clinic to get more medicine. The clinic said, we can't give you more medicine. I mean, we can't see you here because you have COVID. So if you can't breathe, just go to the ER. They literally left her without any medicine. And that's when she became desperate. And she called me in a last ditch effort. She even said, and it's true, if I go to the ER and get intubated, I'll die. And I'm like, yeah, you're right. 60, at that time, she was like 62 years old, has asthma, has has COVID. Oh yeah, the likelihood was definitely there. And she goes, is there anything I can do right now? And I said, well, what you need is 12 milligram chlortrimeton, but for whatever reason, you can only buy that at Amazon or at chlorphin12.com. That's the only 2 places I know of to get it. And so what you can do is go to Walmart right now, look to the bottom shelf. Nobody wants it. Chlortrimeton 4 milligram is on the bottom shelf at Walmart. The disadvantage is it only lasts 4 hours. 12 milligram lasts 12 hours, and it's not near as strong. 4 milligram chlortrimeton does not equal 12 milligrams, not even close. But anyway, get 4 milligram. You're going to take, I told her you're going to take, the label says to take 2 tablets every 4 to 6 hours. Well, in the case of now any medication advice that I give, I have to say, I have to preface it by saying, my friend of my friend does this, and it worked well for him. So I'm referring to my friend now because I cannot personally give medication advice to anybody because I'm not a nurse practitioner or a DMD or a DO. And so any advice I say to you regarding medicine, it would be my friend of my friend does this and it works well for them. I can't personally give medication advice. But anyway, I told her, get chlortrimeton, 4 milligram at Walmart, go home. I know the label says 2 tablets every 4 to 6 hours. You're going to take 4 tablets right now, and you're going to take 4 tablets or more in an hour from now. If it gets worse an hour from now, you're going to take more, 6 tablets or whatever. You're going to take enough chlortrimeton to dry out your lungs and your respiratory system, and quit the sneezing and quit the symptoms of COVID. And she goes, okay. I said, every hour on the hour, you may have to wake yourself up at night. Okay, I can't hardly sleep at night anyway. Okay, all right. So you call me in a week. I want to see if you're still alive. And she goes, okay. Well, 2 weeks later, she hadn't called me, and I called her, and I actually got a hold of her. And I said, well, I see you're still alive. That's exactly what I said. I see you're still alive. What happened? And she goes, well, after about a week, it went away. And I'm like, Tammy, did you just tell me that 4 milligram chlortrimeton that cost 4 cents a tablet from Walmart cured your COVID, and your antibiotics and antivirals that cost $500 a script did nothing? And she's like, well, that's kind of what happened. You know, in addition to the bronchitis element, well, let's see. So at 25, I found this out, but I didn't believe the guy. Remember that? So but I wanted to try the system and taking antihistamines and see if I could get it to work. And so I noticed that I still had bronchitis after I first started this program, this serious bronchitis, but I wasn't taking antibiotics. I was using the antihistamines to get over it. And then I did get over it. And even though it was really rough, I got over it. Then I realized later is when I found out that you can take more chlortrimeton than what is marked on its label. And the way I found that out is that, I have always been one to trust everything a doctor says. I was raised in a very Christian-oriented family. We trusted authority. We trusted the police. We trust the physicians. It has to be proven to me before I would do something that a physician would recommend that I not do. And that's still true today, but a couple of things have been proven to me, and one of them is the use of chlortrimeton. There are actually, I looked this up, there are actually 3 medicines that you can really take more than what is on the label, and that would be chlortrimeton, Benadryl, and meclizine. Benadryl is also a better known antihistamine, but doesn't work as well for me as chlortrimeton. But if Benadryl works, then that's fine. And then there is meclizine. Meclizine is a vertigo treatment, but it is an antihistamine in the antihistamine class. And the way I found out that you can take more of these 3 medicines is that I went and got vertigo. Vertigo at about the same time that at about 25, 26 years old. And vertigo is a really, really, really bad upset of your inner ear. It causes intense dizziness to the point your eyes are spinning and you become blinded. It's amazing how dizzy. It's just an awful feeling. And if you have vertigo that bad, serious vertigo, and you keep your eyes open, you will vomit. And so you have to keep your eyes closed. But there's a treatment for it, and it's called meclizine. Well, after going to a doctor several times, I found out that the doctor literally told me, you can have all the meclizine you want after several visits. And so then I went home, and I wanted to do the maximum dose is 2 tablets in 24 hours. I wanted to do I wanted to limit how much I took. So I took 1 an hour until the vertigo went away. Well, I took 8 of them, and then I fell asleep. The antihistamine, it's an old antihistamine that makes you drowsy. I slept for about 8 hours. I woke up. I have never had vertigo since. It cured it. I've never had it since. And so then I got to thinking, I thought, well, if you can take more meclizine than what's on the label and it works, which it does, it works very well. Can you do that with chlortrimeton? So I tried it. I've been taking chlortrimeton, chlorpheniramine maleate is the name of the drug, at an overdose rate for 40 years. I would submit to you, if you know, old antihistamines are known for potentially causing dementia. I would submit to you, if it was, wouldn't it have caused that by now? You know, anyway, I mean, it's a wonderful drug, but I developed another problem at the age of 40. So I went from 30 to 40. I mean, well, let's back up a little bit. From 25 to 30. So by the time I got to 30 years old and I was taking more chlortrimeton, it was working better. And I noticed that my bouts of bronchitis really weren't bronchitis anymore. They were more like a cold. And then it was literally, you know, I mean, I didn't have anything. I didn't have any problems. I'm still taking antihistamines every day, but you can feel, once you get used to taking antihistamines, you can feel your lungs fill up with fluid before you ever get sick. And so you get used to taking antihistamine. And this is not an addictive medicine. I want people to know that. It is not addictive at all. Antihistamines are not addictive in any way. But they dry up that environment in your respiratory system. It's very important. You see, it's I got to explain, you know, how you get a cold. A lot of people don't even realize how colds start. They start because of the environment in your respiratory system. If it's too moist, it's conducive for the growth of bacteria or viruses in your respiratory system. And that's just how it is. And not only that, the bacteria and the virus use that moisture. It has sugars and salts in it that they need to reproduce, and they thrive off of it. And your body, your immune system secretes it it's supposed to flush out the invading virus or bacteria. It doesn't work. It makes them grow, and you get a lot worse. That's how you get pneumonia. Is you die. You're literally hurting yourself on your own fluid. It's caused by your own body more than the bacteria or virus. And so you manage this with chlortrimeton. And so, but anyway, by the age of 30, I started realizing, you know, look, this bronchitis problem that I used to have is under control now. And one day I said to myself, you know what? This bronchitis does not control me anymore, but rather I'm in control of this bronchitis. And when I told myself that, my need for chlortrimeton dropped, and my ability to avoid the bronchitis went up. It's mental. If you tell yourself, you know, oh my gosh, I can tell a cold's coming on, I'm going to be sick for a month. You know what? You're going to be sick for a month. But on the other hand, if you tell yourself a cold is coming on, oh, here's a chance to learn a new bacteria to gain the antibodies that I need to defeat a new bacteria. Bring it on. Let's see what you got here. And that's the attitude I take. It's all about it's once you get a management on this problem, a hold of it, you gain confidence and you get even more stronger to overcome it. And so anyway, so I had that under control, but then at age 40, I developed a new problem related to all of the, you know, when you have bronchitis and pneumonia countless times, in addition to losing 20% of my lungs, I developed asthma at the age of 40. And this is a whole new problem. It can't be treated. It's not treated with chlortrimeton. Chlortrimeton will not treat it. And so I had a new problem, and so I literally started having to take steroids. And I'm talking IV steroids. I mean, I had severe asthma, and I didn't know what to do. You know, I was stuck, and I learned my own wife and my daughter taught me two more drugs. I thank them. I thank them every day because, being on steroids, just like antibiotics, they are serious problems. These are serious drugs. They will cause you problems long term, and both antibiotics and steroids. Now, remember, I am in no way against antibiotics or steroids for other areas of the body. For example, if you got a bone infection, if you got in a bad car accident and your knee was shattered and you had to have knee surgery, that's a bone surgery. You have to be given potent antibiotics to keep from dying of wound infection, of sepsis. So that's a situation where antibiotics are definitely called for. But for lung infection, antibiotics are a no-no. They only make it worse because the reason antibiotics are so bad is that your immune system becomes used to them. It goes to sleep. I've got these fancy antibiotics. I don't have to do anything. And the bacteria, the virus, develop what's called super bacteria, super virus. Instead of like, for example, Staphylococcus aureus. Now they have MRSA, methicillin MRSA, methicillin resistant Staphylococcus aureus. So it's a super bug. And so then you have to take cephalosporins, and you have to take even more fancier and more expensive and more side effects antibiotics. For use in the lungs, antibiotics and steroids pretty much not called for. Now, in some people with severe asthma, maybe they would need steroids and maybe they would fail what I'm doing about asthma. I don't know. But remember, my asthma was severe enough that I was taking IV steroids and then oral steroids afterwards to get through it. And now I don't take steroids. I took steroids for 10 years from age 40 to 50. And at 50, my wife said to me, you know that this medicine dextromethorphan is really very effective it reduces my asthma, my wheezing. And I said, really? And so I got on that and I said, wow, it does. I wonder, oh, that's neat. And so I started taking dextromethorphan. Dextromethorphan is sold as a cough suppressant. It is not sold as anti-asthma, but it is effective. It's very effective. Literally keeps me from needing IV steroids. It's the truth. It's just the simple truth. And then the other aspect of asthma as it relates to bronchitis and chlortrimeton, you must take guaifenesin. Guaifenesin is an expectorant. It helps you get mucus out of your lungs. You see, asthma is a bronchoconstrictor. So now it's going to be the mucus is stuck. It's going to be stuck in there. And chlortrimeton dries it out because it's a drying agent. Some physicians will tell you, if you have asthma, don't take chlortrimeton. That's not true. You take chlortrimeton because you don't want to have an infection growing in your lungs. And then you take guaifenesin, which is an expectorant, and it helps you to get mucus out of your lungs. It is very effective. So you need both of those drugs, especially if you have any sign of asthma, or you will not get over that problem. That lung problem. And so with those three medicines, chlortrimeton, guaifenesin, and dextromethorphan, and guaifenesin, remember, are sold as Mucus DM or Mucinex DM, Mucus DM being the Equate generic version. They're sold together like that, but I take them separately because for one thing, a lot of times nowadays, I don't have anything but asthma. I got asthma almost every day, and so I take dextromethorphan every day, and chlortrimeton, of course, every day because of my super high IgE level, and that's all I do. And you can see right now today, I'm breathing just fine, and I wouldn't have been if you'd have saw me when I was 20 years old, for example. Every day it was a mess, and it got so bad from age 23 to 25. I was literally taking antibiotics every day, and they told me, the physician at the time that prescribed them to me told me, "Oh, I've got lots of patients on antibiotics every day. It's a common thing," and that's what I went from. I went from that to this. I don't use antibiotics or steroids and haven't since I was 50. I'm 63 now. There is no reason to have other people go through this like I did. No reason at all. All of that, the CF floor that I spent in the 7th grade and all that loss of school, it was all preventable just by using antihistamines. So I know it sounds crazy. People don't believe me, but it's just how it is. It really is.
Colonel, I appreciate the information that you're sharing with us, and once again, give us the 3 medications that you were recommending, or I'm not recommending,
Remember,
but you were talking about. Yes, that's right.
Yeah, it's my friend of my friend recommends
Correct.
them, and it's going to be chlortrimeton. You want me to spell them?
Sure, I think that would help out with
Okay.
our public.
CHLOR-TRIMETON. And 4 and 12 milligram. Get 12 milligram at Chlorphen 12 is a little cheaper than Amazon. You can get it at either place, but Chlorphen 12 would be CHLORPHEN 12.com. And then there's dextromethorphan, DEXTROMETHORPHEN. And then there's guafenesin, GUAFENESIN. Now, guafenesin and dextromethorphan are available separately at Amazon. That's where I get them. They're available together as Mucus DM or Mucinex DM at Walmart. So now Walmart's chlortrimeton is 4 cents a tablet. There's 100 tablets. If you like 4 milligram chlortrimeton, which I do, I use a lot of it. You can get 1,000 tablets for a penny a tablet at Amazon. $10, 1,000 tablets. And then the 12 milligram is more expensive. It's 67 cents a tablet, but it is way more effective. A lot of people probably won't need it. 4 milligram is very effective for most people. My wife is a good example. My wife is she's from Indonesia, but she's more like everyone else. She has a cold, maybe in 2 or 3 years, she might have a cold and take antibiotics maybe once. And so she came here to give you another example of someone else I fixed. She came here to the U.S. and I told her that I have a long background in lung illnesses, and I know, there's brand new viruses and bacteria you've never seen here, so you're going to get ill, and it'll probably be bad once you get here, and that I will take care of you, and that's not going to be a problem. Well, she didn't. She just blew me off, So then she goes and she got here, and 2 months later, she's ill, really bad. Oh, she was miserable. And remember, I developed a lung care treatment program just for this, just for lungs. And part of my program is that other people around you are doing the same thing you're doing. If somebody's really sick around you, like my wife, then they're going to make me sick. And so I did not want this. I did not want this at all. But she wouldn't take the chlortrimeton that I was suggesting. She's Asian. Asian people, and I knew this too. I'd already read about this. Asian people don't trust RNs. They don't trust RNs at all. They only trust physicians. They think RNs are like servants, which in Indonesia, I suppose they are. But RNs actually can do quite a few things in civilian life. And so I told her that when I was in occupational health nursing, we wouldn't allow people to go to the doctor until they had a 101-degree fever with respiratory infection. So I told her, well, let's take your temperature. Well, her temperature was 98 too, and she was miserable. And I said, well, you don't qualify to go to a physician because you don't have a fever. And oh my gosh, I had one really seriously upset Indonesian on my hands. And I mean, I felt for her. She was over here. I was the only person here that she even knew, and she didn't even know how to go to a doctor. She couldn't drive. She didn't have a driver's license. She was totally dependent on me, and I wasn't taking her to a doctor, and it was a real problem. And I was trying to keep her as calm as I could because I knew that you can run your fever up just from being angry. And that's what I was afraid was going to happen. And then I'd have to take her to a doctor. So I was really concerned about her. She wouldn't take anything. And so I waited till the next day. And, lung illness always gets worse at night. And so the next morning, the second she wake up, I took her temperature. The next morning it was 98.4. And that's when I started getting into her head. I said, you know what? You are tough. And it's true. If I was as miserable as her, I would have had pneumonia the next day. I guarantee it. But she has a much lower IgE than I do. And so the next morning she's 98.4 and she's even worse, miserable. And I'm like, you are tough. If you would just let me help you a little bit, you're going to take off like a rocket ship. And she just scowled at me and wouldn't do anything that particular day. And so we wait till the next day. And the next day she's 98.6. I was stunned. I was like, oh my gosh. And she's even worse. And finally she goes, just do whatever you want. I was like, wow. And I gave her 2 12-milligram chlortrimeton. She'd never been on antihistamine before. So that's quite a lot for someone who's never had anything, but she was incredibly miserable. And so she went to sleep and slept about 8 hours. It's an old antihistamine. It does cause sedation when you first start taking it. And she woke up 8 hours later and she's like, what did you give me? That is good stuff. I like that. And I gave her one more 12 milligram and that cold was over. And now it's 23 years later. She has never been to a doctor for antibiotics for lung infections ever. And she literally tells me that I saved her life. But really it was too easy, and much easier than it was for me. And she only, most of the time, 90% of the time, she only uses 4 milligram. If it gets kind of bad, she'll use 12 milligram, but I don't even realize it. She don't even, neither one of us, we don't even sneeze. And you just know when you need it and you take it, and then you don't have colds. That's the best thing to do. A lot of people say, well, I want to get over it naturally. I don't want to take anything. Well, you want to take the correct things. You don't want to take antibiotics and steroids for lung problems, but you do want to take the correct medicine. And then you won't have to go to that step. At least most people. If you have an otherwise normal immune system, I'm very confident. I've never ran into someone yet, and that's one reason I do this. I want to find somebody that my system won't work with, and I haven't found them yet. And then I'm also writing a book. I might as well give my 4-point plan on lung eradication and treatment. Primary is the first step. Primary is the medicine you're using. So this case, one of the 3 medicines we just spoke about. So then secondary treatments are also very important. Secondary treatments are things like coffee, tea. These are things that will help you deal with the cold. Coffee and tea have caffeine in them. They're great decongestants. Getting rid of mucus, breaking up mucus. It's caffeine is a wonderful medicine. But don't ever take decongestants that are well known. Sudafed, we might as well talk about drugs not to take. And that would be Sudafed would be the number one. Sudafed has pseudoephedrine in it. All that does is raise your blood pressure and heart rate, and it does absolutely nothing that you need as far as getting over a cold problem. And you can't even take it if you ever get on blood pressure medicine like I am now. Anyway, what you need to do is get on a lung plan that you can do the rest of your life. And Sudafed is out. But so anyway, secondary treatments also include salt. Salt is very important. Remember, your mucus, your histamine is made up of saline, sodium. And in my case, my histamine level is so high that I have to take extra salt. I'm hyponatremic, in other words, low on sodium. And so I literally have to take more salt, even though I'm on a blood pressure medicine. I have to take sodium. So when you have a cold, you're secreting more IgE, and therefore you need sodium. Sodium is wonderful as far as a secondary treatment for this. Whenever I have a sore throat, I can take salt and drop it right on my throat. You can feel sodium is is a jagged mineral underneath a microscope. It's very jagged edged. It's very nasty, and it points. It literally cuts the cell walls of bacteria and viruses and kills them on the spot. And you could feel it. It makes your throat feel so well. Cough drops. There's all sorts of things. Ginger is a great natural remedy for asthma and colds. My wife introduced me to that from Indonesia. Ginger is wonderful, unbelievable. There's several others. Those are secondary treatments, but still very important. They reduce your need for the primary ingredients, which is really nice. And so then there's primary, secondary, now there's tertiary. Tertiary is the idea that everyone else in your immediate area is doing what you're doing. And then the fourth thing is coping skills. In other words, looking at your whole body and how to strengthen your whole body. When you're looking at coping skills, you're looking at, first you look at 5 things not to do. One thing I learned from bronchitis is quit doing what you're doing that's not working. And those things would be, and I developed this program when I spent 10 years as a psychiatric nurse at Fort Hood, 5 of them at Fort Hood. And I developed this program there for the mental health patients, but it was because I was able to do it because of my lung issues. And so the 5 things not to do would be anger, anxiety, depression, substance abuse, and personality disorder. And it's very interesting. I never had anger, anxiety, or depression when I was young. Why? I was walking on eggshells. If I had anger, I would have died. I mean, that's how I was scared to death that I was going to get pneumonia and die at any moment. I mean, it was that bad. And so I never had, I promise, I never had anger, anxiety, or depression when I was young. If I started feeling down, I'd be dead. I would, when you are that bad, you have to use adrenaline literally to keep yourself alive. I would stay up at night because I didn't think I'd be able to wake up the next day. I mean, crazy things to be able to survive. And it also turns out that I had a good father. My daddy raised me and took care of me. He's very strong, very tough, Irish. We're tough. We're McGinns. Let's go to work. And so he would give me one day off if I had pneumonia, and I'd be out of the bed the next morning. And that's exactly what I needed. But anyway, so coping skills, the things not to do: anger, anxiety, depression, substance abuse, and personality disorder. Now you got to get to the things to do, and that would be mental and physical health, marriage and family, having spirituality of some kind, a hobby, and a career. And that all 5 of those be in balance, that you say your career is not overwhelming all the others. If you can do that, that's called coping skills. And if you get the rest of your body strong, your lungs will be stronger too. And whatever else you may have, whatever other kind of illness or whatever that you have will be stronger.
Fantastic.
So
I think that's great advice.
Yeah.
I appreciate you sharing that with us. Can you repeat
You're
those
very
coping
welcome.
skills again?
Yes, that would be anger, anxiety, depression, substance abuse, and personality disorder. So there are a few people out there that have personality disorders, and it's a very unfortunate problem that you normally get it from being heavily abused as a child. And so people who have it know, but personality disorder, it would be borderline, antisocial, and narcissism are the three main ones. And then dependent personality is the kind of person that marries people who have antisocial, borderline, and narcissism. It's I could get more involved in it, but I don't know how much information people want. But
That's great
it's
information for the next
used,
show.
yeah, yeah. It's used, the personality disorder, for people who have them use them in order to gain things, and it's not a good way to cope at all. And so then there's the positive coping. It would be marriage and family, mental and physical health, a career, spirituality of some kind, and a hobby. And that those five be in balance. Some of my mental health patients drilled down with me and said, "Oh, wait a minute, is it really important that I have all five?" And I thought about that, and I thought, they're kind of right. I mean, it's kind of rigid to say you got to have all five of those to be like healthy. And so I told them, the way I would look at it is a car has four wheels and it's fairly stable. So if you got, I'd say 4 out of the 5, that you would be fairly stable. Ideally, 5 out of the 5, but 4 out of the 5, I think you could still be stable. But remember the three-wheelers, if you only have 3 of those things, they tip over very easily. So now you have to slow down a lot. You have to be very careful what you do if you only have 3 out of the 5. So you're hopefully looking at the other 2 that you're missing, it as far as what could I do to gain coping skills. A lot of people they'll move, and then when they move, their coping skills are all different, and then they don't find new ones. The Army we see this a lot in the Army. They'll move and then they're lost. They have no coping skills, and then they fall apart. And so in the Texas State Guard, for example, they go to Operation Lone Star. They don't have their family. They don't have their hobby, their gym. They don't have whatever out there on the border, and then they fall apart. You got to think about these things beforehand and have your coping skills in place before you go to there, or if you're active duty, before you move to the next duty station. You have all this in place, and then as soon as you get to the next place, you're picking up the coping skills that you need from there. And what I found through bronchitis is that practicing this, I was doing most of those things. I've never been a mental health patient myself, and so I was practicing most of those things already, but I wasn't focusing on them, and I wasn't thinking about it. Now I think about it and do it on purpose. It works a lot better, and my lungs got even stronger. And everything in life has always been, does it make my lungs stronger? And if it does, I keep doing it. And it's been very successful. I am very humble. I appreciate it so much because I don't have to live like I used to live, and I just want it for other people now. There is no reason. I've been to the bronchiectasis and bronchiolitis and bronchitis support groups on Facebook, and these people are desperate, but they won't do anything. They won't try anything. They think they don't believe me. It's very interesting. There's only so much you can do. But I'm going to keep trying. I'm going to keep at it. I won't stop. It's like my life's mission. So
that's a very important mission, very unique as well. And so I appreciate it. Appreciate all this great information. And I know we can sit here and continue talking. And I want to invite you for the same reason. I want to invite you over for another interview. And so once we get off the air, we'll schedule it and at a time that's convenient for you. And we're going to continue disseminating this important information to all of our viewers. Now, before we wrap up, is there anything else that I might have forgotten to ask you? Anything else you want to add?
I don't know. I would just say try to get yourself in the best place possible so you can face life's challenges in the best possible way. So
Great advice. Great advice.
Well-
Well, thank you, Colonel, for making the time to speak to our audience, and we look forward to the next interview. And we want to thank you, those that are watching us and following us on social media or listening to us online or however it is you're catching our signal, locally, internationally, wherever you're at. Thank you. If you've got any questions, reach out to us in the studio, and we'll get those questions over to Colonel McGinn. Once again, Colonel, thank you. The doors are always open here at 97.7 FM for you.
Thank you very much. You're very welcome.
Have a great evening. And also, for those of you that are here watching us, have a great evening. If you find that this information is important, share it with one of your loved ones, okay? Send them a link to this video, have them watch it, have them take down notes, because a lot of very important information was given here. So, as I promised, it was a great interview. And until next time, keep it right here on 97.7 FM, The City.